Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please show your face during the picture taking. A reminder, after the pep talk, please take the online learning cum evaluation test exercise, or OLETE, for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee, one participant, to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video and show your faces. All, show your face if you can, so that, okay. Ready? 1, 2, 3. Okay, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. So this part of the slide shows the topics on the core courses, on the core course. Okay. And then from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. So these are samples of the health disorder courses and samples of the health issue courses. Today, it will be it will be on a health issue. Okay. So this particular pep talk may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. Actually, we are now on our 3rd year, and we'll be completing the 3rd year on May 15, 2024. My pep talk today is entitled, "Can One Skip Chemotherapy in Breast Cancer Treatment?" As I said, this is a health issue topic. Okay. And the empowerment objective is for the lay people to have an essential understanding on whether one can skip chemotherapy in breast cancer treatment as part of their health management. The reason why I put up this topic is because I encounter a lot of patients with breast cancer asking me whether they should undergo chemotherapy or not after surgery or even before surgery. The contents of this particular pep talk will be the following. What is chemotherapy? I'll start with that basic information. And then what is chemotherapy in breast cancer treatment? And lastly, the main issue here is, the main question is, can one skip chemotherapy in breast cancer treatment? I'd like to have a disclaimer that this pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from my personal experiences as well as from experiences of other professionals. What is chemotherapy? The first topic. Chemotherapy is the use of drugs, gamot, medications to destroy cancer cells. And this type of cancer treatment works by keeping the cancer cells from, number one, growing, dividing, and making more cells. As we know, this is the behavior of cancer. They keep on growing, dividing, and making more cells without any control. Chemotherapy is a systemic medication. When you say systemic, it means the drug travels through the bloodstream and reaches all parts of the body. So the contrast to systemic is localized, kung saan lang ang tinatapat yung gamot o yung gamutan, that means localized. But chemotherapy, umiikot, drugs kasi yon, umiikot sa buong katawan at hinahabol niya yung mga kung saan merong cancer. Okay? So systemic medication. There are many different kinds of chemotherapy. In general, drugs used for chemotherapy are powerful chemicals, mga chemicals ito, that treat cancer by attacking cells during the specific parts of the cell cycles. Later on, I will show you the different types of phases of the cell cycle. All cells go through the cell cycle, which is how new cells are made. And cancer cells go through this process faster than normal cells. That's what makes it notorious as cancer cells. So chemotherapy has more of an effect on these fast-growing cells. Because chemotherapy travels through the whole body, as I said, systemic, it can also damage healthy cells. Kasi yung healthy cells are present throughout the body. Okay? So it can also damage these healthy cells as they go through the normal cell cycles. So tinatamaan yung cancer cells as well as the normal healthy cells. And this is why chemotherapy can also cause a lot of side effects like hair loss and nausea and other complications. The goals of chemotherapy depends on the type of cancer that one has and how far it has spread, meaning the stage. Okay. And chemotherapy can be given alone, isa lang, or as part of a treatment plan that includes different treatment, like combination chemotherapy or added treatment like radiation, other types of modality of treatments like surgery, pwedeng i-combine, no? Okay. Or immunotherapy is another example. Okay. So it can be given alone as a drug regimen or as part of a treatment plan that includes different types of treatment. And tinatawag na combined modalities of treatment. No? And chemotherapy can, as I said, can be given as one drug or combination of several drugs. Some of the ways chemotherapy is used or are used include the following. Number one, as a primary treatment. So this might be called the curative chemotherapy. Yan ang popular term. Yung pinaka-unang gamutan, the primary treatment, and usually the only treatment, pwede na yun. No? Now, the other way of using the chemotherapy is before other treatment. This can be called neoadjuvant chemotherapy. Example, before surgery, kung binibigyan ka ng chemotherapy, we call that neoadjuvant chemotherapy. So, chemotherapy is given before surgery. Okay. Now, the third way is after other treatments. Tapos na yung surgery, tapos na yung radiotherapy and other types of treatment, no? Then binibigay yung chemotherapy. Now, this is what is popularly known as adjuvant chemotherapy. Adjuvant. Yung isa before the treatment, neoadjuvant. Yung after the treatment, after another treatment like surgery, then the term here is adjuvant chemotherapy. And the last way of using the chemotherapy is to slow the progression of cancer and relieve symptoms. This is usually used for the patients with advanced diseases, and then there is a very small chance for cure already, but chemotherapy is used for this purpose to slow down the progression of cancer and relieve symptoms. So this is what is called palliative chemotherapy. Palliative chemotherapy in contrast to curative chemotherapy. In curative chemotherapy, may magandang chance pa ma-cure. Okay? But in palliative therapy, maliit ang chance mag-cure, but the purpose of giving the chemo is just to slow down the progress, the continual progression or development, paglala ng cancer, and then to relieve the symptoms. Okay? So as a primary treatment, let me amplify on the 4 ways of chemotherapy. As a primary treatment, so sometimes the goal of chemotherapy treatment is to get rid of all the cancers and keep it from coming back. Usually, mga early stage cancer ito na pwedeng matanggal lahat, no, with the hope that it will promote a cure, no, para hindi siya bumalik, no. So this is what is popularly known as curative chemotherapy. Now, before other treatment, as I said, it's called neoadjuvant chemotherapy. It's being given before surgery or radiation therapy to shrink the tumors. Usually, kung malaking-malaki na yung bukol na mahirap operahan, mahirap isara after the operation, we doctors usually give chemotherapy to shrink, to make the cancers, the tumor smaller so that we can do the surgery more easily. After other treatment, okay, this is what is called adjuvant chemotherapy. Okay. Chemotherapy can be given after surgery or radiation to destroy any remaining cancer cells. Yung neoadjuvant is primarily to decrease the size of the cancer tumor. And then adjuvant naman, it's natanggal na, operahan na, na-radiate na, baka meron pang naiiwan na mga cancer cells. So this is the purpose, is to destroy any remaining cancer cells that may be present. Now, the last way of in the use of the chemotherapy to slow down the progression of cancer and relieve the symptoms. So even when the cancer is not curable, chemotherapy can still partially shrink tumors and prevent tumor growth and spread for various length of times. In such settings, chemotherapy can extend survival, mahaba konting buhay, relieve cancer-related symptoms, and then improve the quality of life. So ito yung pwedeng i-target ng chemotherapy for those who are in the advanced stage. Okay? Chemotherapy used for this purpose is what is called palliative chemotherapy. As I said, in contrast to curative, may good chance for cure. In palliative, ang ginagawa na lang is to palliate, is to make things easier for the patient who may graduate from this life anytime. Chemotherapy can be used to treat many types of cancer. It can also be used to treat recurrent and metastatic cancer. So yung una, yung wala pang recurrence, yung unang na-discover, then it can be used as the treatment, primary treatment. And then kung nag-recur na, nag-metastasize, pwede pa rin gamitin yung chemotherapy. So recurrent cancer means it's a cancer that comes back after treatment. And metastatic cancer is a cancer that has spread to other parts of the body, especially to yung mga malalayo na lugar. Example, kung sa breast cancer, may cancer ka sa lungs, na malayo sa breast, then we call that metastatic cancer. So pwede ding yung cancer sa breast, pwedeng lumipat sa brain, we call that brain metastasis. Then sa bone, then sa liver, these are the 4 common areas of distant metastasis, distant recurrence. What factors determine a chemotherapeutic plan, chemotherapy plan? So usually may plano yung mga doktor, how to give the chemotherapy. So number one, we have to remember that there are many drugs available to treat the cancer. So one may receive a combination of drugs because this sometimes works better than one drug by itself. As I said earlier, pwedeng isa lang, one kind of chemical drug, or sometimes they use 2 or 3 drugs in one sitting. Isang bigayan. Na? Okay. So the drugs, those treatment schedule depend on many factors. So this may include the following factors: the type of cancer, the specific type, no? Okay. The stage of the cancer. Cancer stage is usually determined by the size, gaano kalaki yung tumor, the location of the tumor, and whether or not the cancer has spread to the axilla or to distant areas. Okay. So tumor size and its location, and whether it has not, whether if or where it has spread. Okay. Another factor to consider is the age of the patient and the general health. Okay. So usually pag matanda na at frail ang health ng pasyente, the dosage, the type of chemotherapeutic plan will be adjusted. Okay. Then the other factor that will be used to calculate for the drugs will be the body weight of the patient and the possible side effects of each drug. And then any other medical condition that a patient has, kinoconsider din yan, and also previous cancer treatment. Okay? Yung mga nagamit na dati, baka pwedeng, usually hindi na ginagamit ulit. Chemotherapy may be given in several different ways. Number one will be, the more common will be the intravenous chemotherapy, so through the blood vessels, and oral chemotherapy through the mouth. Injected chemotherapy means yung ini-inject sa braso, sa hita, direct to the muscles. Chemotherapy into an artery, which can also be done, but it's not very commonly done. Chemotherapy into the peritoneum and abdomen can also be done, usually done for yung mga ovarian, gynae cancers. And then topical chemotherapy, yung pinapahid lang. But as I said, the more common route for the chemotherapy are these two, intravenous chemotherapy and oral chemo. And between the two, mas common yung intravenous through the vein. Types of chemotherapeutic drugs, as I said, okay, there are so many, it can amount to 100 different drugs. And the main types of drugs that the chemotherapies can be grouped into these 6 categories. You don't have to memorize that. Okay, I just mentioned that there are 6 groups of chemotherapeutic drugs: alkylating agents, antimetabolites, anti-tumor, antibiotics. Okay, topoisomerase inhibitors, mitotic inhibitors, plant alkaloids. Just take a look. You don't have to memorize this. So chemotherapy in combination with other treatment, as I said, it can be combined with other treatment like surgery, radiation, and also hormonal therapy, immunotherapy, and targeted therapy. Okay. So when you say hormonal therapy, strictly speaking, it's not the same as chemotherapy. As I said, chemotherapy is the use of drugs to kill the cancer cells. In hormone therapy, this is a type of cancer treatment that removes, blocks, or adds hormones, specific hormones, to the body. It is also called hormonal therapy or endocrine therapy. Examples in sa breast cancer, examples would be tamoxifen, letrozole, anastrozole, etc. Immunotherapy is another kind of treatment that can be used in combination with chemotherapy, okay, but it's not the same as chemotherapy. Okay, it's a type of treatment that helps the body natural defenses fight against the cancer. So this is the mechanism of the immunotherapy. It tries to boost the natural defenses of the body to fight the cancer. Targeted therapy as another type of treatment. Okay, this treatment target and disable genes or proteins found in cancer cells that the cancer cells need to grow. So genes ang tinatamaan dito. Example of this targeted therapy in mga patients with breast cancer will be the Herceptin or the trastuzumab. How long is the chemotherapy? Chemotherapy is often usually given for a specific time, hindi lang once, but usually 6 months or even a year. But the more common regimen duration is 6 months. Okay. Or one may receive the chemotherapy for as long as it works, pwedeng 1 year, 2 years, go on. Okay. Then the side effects are because the side effects from many anti-cancer drugs are too severe to give the treatment every day. Hindi pwedeng every day, no? Kaya merong cycle, no? So doctors usually give these drugs with breaks, may mga intervals so that one has time to rest, no? And recover before the next treatment. This lets one's healthy cells heal. The usual interval, the common interval is every 3 weeks. Some would give it every 2 weeks. Some even go for every month, but usually every 3 weeks. Ang interval between 2 chemotherapeutic sessions. For example, one might get a dose of chemotherapy on the first day and then have 3 weeks of recovery time before repeating the treatment. This is what I mentioned earlier. And each 3-week period is called a treatment cycle. Yan ang tawag doon, treatment cycle. And several cycles make up a course of chemotherapy. So a course usually lasts 3 months or more. So ang course is yung pinakabuo and then broken down into usually mga 6 na every 3 weeks. Na? The common side effects will be the following. I just list down all these common side effects. Fatigue, hair loss. May mga chemotherapy that doesn't cause extensive hair loss, but most of them will cause hair loss. Alopecia, yung mga nakakalbo, no? Easy bruising and bleeding. Infection is another possible side effect. Anemia, low red blood cell counts, and usually the other cells counts are also brought down, bumababa rin, like WBC and even platelets. Yeah, usually before the next chemo, usually check yung blood counts. Then nausea, vomiting, which is quite common, but there are drugs being given to counteract this. Appetite changes, constipation, diarrhea, mouth, tongue, and throat problems such as sores, yung mga singaw, yung masakit na may sugat, and then pain with swallowing. Peripheral neuropathy such as numbness, tingling, and pain, quite common sa mga chemo. Skin and nail changes such as dry skin and color change, yung mga nangingitim na kuko, nakikita tayo. Urine and bladder changes and kidney problems. Weight changes. Yung iba pumapayat, yung iba tumataba. Kadalasan tumataba, no? From my experience. No? Chemo drain, meaning this affect the concentration of the mind, okay, and focus. Mood changes, changes in libido and sexual function, and then fertility problems. So this is just a list of common side effects of chemotherapy that can happen to patients undergoing chemotherapy. So what is chemotherapy? With that as the foundation, knowledge, basic knowledge foundation, we now go to what is chemotherapy in breast cancer treatment. More specific now, referring to breast cancer. Okay. So again, this is chemotherapy is the use of drugs. Okay, but this time in breast cancer, it's used to destroy breast cancer cells. It is a systemic medication. This means it travels throughout the bloodstream and reaches all parts of the body. It can reach as far, it can attack the, kung merong brain mets, na utak, kung may lung mets, it can attack that. It can, kung may bone mets, it can also attack those on the bone and also in the liver. And as I said, it's usually given parenteral, but at times oral chemotherapy can be given also for breast cancers. Maybe or usually used in combination with hormonal therapy, targeted therapy, and immunotherapy. Yeah, for those who have experience with this chemotherapeutic uh, treatment, you can see that it's a combination of after the chemo, meron ka mga hormonal therapy, and then kung minsan, meron ka pang HER2, okay, or trastuzumab or Herceptin therapy. It may be used as a primary treatment, okay, usually used for early stage breast cancer. As I said, this is called the curative chemotherapy. It aims to remove all possible cancers, hoping to remove all possible cancers before other treatment, usually done in patients with advanced stage breast cancer. Usually hindi na kayang operahan, I mean, hindi pwedeng operahan ng madali, malaki masyado. Kaya binibigay mo na yung chemotherapy sa breast cancer na advanced to make it smaller, to shrink the tumor, and then that operation can come in kung lumiit. Then after other treatment, let's say after usually done for early and advanced stage of breast cancer, pwedeng gamitin ito. And this is what is called adjuvant chemotherapy. And then palliative chemotherapy for advanced cancer, both recurrent and metastatic, just to slow down the growth of the cancer and relieve the symptoms. So, what are the indications for chemotherapy in breast cancer treatment? Number one, the most common indication will be those with advanced stages of breast cancer. The moment you start hearing, ay, kailangan i-chemotherapy ito, usually ang implication niyan is advanced yung breast cancer. The other indication, kung di naman advanced, those with lymph node metastasis, yung pumunta sa kilikili. So we talk about breast cancer, may pumupunta sa kilikili, sa lymph nodes. Kung meron ng positive lymph node metastasis, usually binibigyan ng chemo. This is aiming for a curative chemotherapy. Those with distant metastasis, lungs, sa bones, sa brain, sa liver, and other sites, pwede ding bigyan ng chemotherapy. Okay? This is for palliation. And those with biomarkers for poorer prognosis, such as these are the commonly done biomarkers in the Philippines. You have the ERA, PRA. ERA stands for estrogen receptor assay, and then PRA is progesterone receptor assay, and then HER2 new. Ito yung mga biomarkers commonly done by the doctors. Now, if there are triple negative yung ERA, negative ang PRA, negative ang HER2, no? This usually carries a poorer prognosis based on studies, kaya binibigyan ng chemotherapy. And then, those with positive HER2 new biomarkers, binibigyan din ng Herceptin and also in combination with chemotherapy. Kasi it has been shown that positive HER2 new usually carries a poorer, but not all the time, poorer prognosis. So indications again, advanced breast cancer, lymph node metastasis kung meron, distant metastasis, and then biomarkers na ito yung usual combination, triple and positive. Triple negative and positive HER2 new. So going to the last topic, which is the main issue here, can one skip chemotherapy in breast cancer? So I've encountered a lot of patients coming to see me, pinapakimo ng ibang doktor, pupunta sa akin, tatanong sa akin, pwede bang wala na? Yung iba naman, because if we don't settle this issue, yung iba naman, pag narinig nila na even before the operation, baka kailangan ka magpa-chemo after the operation, umaayaw na, no? Umaayaw na magpa-opera. Okay. So, because of these situations, of these problems, that challenges that I am encountering with patients with possible breast cancer in my practice, I decided to talk about this topic. Can one skip chemotherapy in breast cancer treatment? So the first answer is yes, pwede, but with the following conditions. Okay? Yes, but if one has early stage breast cancer, especially with negative axillary lymph node metastases. Okay? So ito yung pinaka-reliable indications. Okay? So hindi lahat na may breast cancer kailangan magpa-chemotherapy. So if one has an early stage, no, usually mga stage 1, okay, especially with negative lymph node metastases, pwedeng walang chemo. If one has an early stage breast cancer, especially with positive ERA and PRA and negative HER2/neu. Bakit ito? Kung positive ang ERA and PRA and negative HER2/neu, studies have shown that this carries good prognosis. Okay? So pwedeng wala, just monitor. Okay? Basta negative ang lymph nodes pa rin. Okay? Now, if there are medical conditions in the patient that will cause severe complications with chemotherapy, usually we can skip that. We cannot give that because baka may mangyari pa sa pasyente, hindi niya kaya yung side effects ng chemo. Kaya rather than prolonging life, we might be accelerating the life of the patient with chemotherapy. So, ina-assess ng doktor kung kaya ng katawan ng pasyente sa mga possible side effects. Now, the last reason that when you say yes, you can skip. Okay? This is a free country. There's such thing as informed consent. Okay, all adults has the right to self-determination as long as he is well informed. Alam niya kung anong mangyayari. No? So he decides or she decides that he doesn't want for one reason or another. Such as mindset niya, hindi siya naniniwala, o kaya no, na talagang naniniwala siya ibang gamutan and does not believe in the usefulness of the chemotherapy. Okay. So we will respect that. The physicians cannot force any patients to have chemotherapy. Okay. So again, I like to spend more time here. Ito kasi basic issue ng topic ngayon. Can one skip chemotherapy in breast cancer treatment? One has an early stage breast cancer. Kaya importante, titingnan nyo yung lymph nodes ninyo during in the histopath, yung biopsy report. Okay. Now, if one has early stage breast cancer, kung meron kayong ERA, PRA, HER2/neu, okay, kung negative yung HER2, positive ang ERA, and then kung meron kayong medical conditions that will be more harmful rather than offering more benefit to the patients, then we don't have to go for the chemotherapy. And then, of course, we will respect the decision of the patient. Now, kung anong gusto niya. Okay. Now, the other side of the coin, no, you cannot skip the chemotherapy in breast cancer treatment if there are valid indications for chemotherapy. Okay, yung binanggit ko kanina, valid indications. Okay. Ibabaliktad lang ninyo, no? So, meaning, if it will offer more benefits in terms of better chance for remission, go for it. No? If one has advanced stage breast cancer, it's like usually you have to go for chemotherapy, but again, it all depends on what you think, no? Okay. What's your mindset? And then, of course, with the support agreement of the family members. And then the third one is if one has advanced breast cancer, especially those with triple negative and okay, those with positive HER2/neu, okay, usually cannot skip the chemotherapy. And kung meron kayong mga biomarkers that shows results like this, triple negative and positive HER2/neu. And if there is or are no medical conditions in the patient that will cause severe complications with chemotherapy, and there will be more benefits than harm. Okay. So the general recommendation on this issue is, except for small, very early stage breast cancer that have not spread to the lymph nodes, most people with triple negative and HER2 positive breast cancer require chemotherapy. So this, because this gives them a chance, the best chance of not having their cancer spread or return or becoming recurrent. But the strongest recommendation that I can give is if anyone wants to avoid chemotherapy in breast cancer treatment, in case one develops, have a personal strategy to catch the breast cancer early enough, such as doing monthly breast self-examination and doing early consult and treatment. So kung gusto nyo to avoid the issue of discussing or facing the challenge of whether you need chemotherapy when you have breast cancer, try to kung sakaling tatamaan kayong breast cancer, try to catch it in the early stage para wala na itong issue na chemotherapy. So summary and takeaway, I've discussed these three major questions. What is chemotherapy? What is chemotherapy in breast cancer? Can one skip chemotherapy in breast cancer treatment? So takeaway in relation to patient empowerment, be always in touch with reliable medical information on whether one can skip chemotherapy in breast cancer treatment. Knowledge is power. It gives power. Use the 4Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan to gain greater control over decisions and make better decisions on whether one can skip chemotherapy in breast cancer treatment as part of your health management. So this is the importance of the patient empowerment. So in relation to that question, can one skip chemotherapy in breast cancer treatment? So you have to know kaalaman, okay, everything, all the indications and the yung pwedeng hindi, pwedeng dapat magpa-chemo, and then in the end, you have the right to make a decision and also kapangyarihan, your self-determination to make the decisions whether you should undergo chemotherapy or not. This ends my pep talk today. Can one skip chemotherapy in breast cancer treatment? I hope I have empowered you to have an essential understanding of whether one can skip chemotherapy in breast cancer treatment as part of your health management. Reminder, after the pep talk, please take the Olete. I have placed the link in the chat box. You can ask me again if you don't see it. And then 50 Olete certificates were entitled one participant here to a voucher for a free ROJoson medical consultation, either face-to-face or telemedical. There are quite a number of mentees, participants who are now availing the the voucher. And then another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the QA and interactions proper. Please turn on your video and show your beautiful faces. Everybody on board? Ready? 1, 2, 3. I will just save it here. Okay, let's have another one because somebody, okay. Let's have another shot. Okay. Cherry, are you in? One, 1, 2. Okay. So the floor is now open for questions, comments, consultations, short consultations. Okay, we still have 20 minutes to go. So how many of you have encountered the challenges of trying to decide whether to have chemo or not to have chemo? Okay, whether after the operation or before the operations. I suppose looking at the participants, a lot of you have gone through this stage of trying to answer, do I need chemo, or does my relative, my mother, need chemo or not? So anybody who wants to share?
Okay.
Okay, Susan. Susan
Present.
did not undergo chemo.
I did not.
Okay.
First, um, you didn't really recommend it. And second, I asked you about, sorry, I have to use another chair. Okay. Based on your what, prognosis or something, you
Yeah,
said that there is no clinical evidence of recurrence.
yeah,
So based on that, uh, but you also said that I have to be monitored, monitoring and surveillance, which well, you're doing. I am doing also with you. Although I haven't seen you face to face for 3 months, kasi you're busy naman eh. So, did I make the right decision with your help, of course?
only time will tell.
What do you mean? Only time will tell.
Yeah, everything is it can be predicted with the course of time, di ba? That's part
Yeah.
of life, di ba? Okay, when we
Okay.
make some decisions, only time will tell whether the decisions that we make, no, for anything, di ba?
Oh,
Titingnan natin kung tama o hindi, na? Okay. So here we're
okay.
talking about kasi ito long term ito, di ba? Kung may mga activities na short term decision that
Oh,
you can already make an evaluation kung tama o hindi. Pero ito, we're talking about like breast cancer which may recur years after, di ba? Matagal, di ba? Okay.
yeah,
So, but
yeah.
we
Uh,
just make the best. When you make decisions, you try to analyze, to study all the possible data on hand, di ba? Yung mga data
yeah,
information that we have on hand, and then try to the way the balance the pros and cons, okay, the advantages, disadvantages, the consequences, the ill bad consequences, or the yung mga positive factors, then come out with with a decision, no? Okay. So sa breast cancer, we start with ano ba yung we call that prognosis of prognosis even before treatment, di ba? Even
okay.
before treatment, if the prognosis is not good, then chances are you have to undergo more extensive treatment. Okay. Now, after, let's say, after you have done one treatment, surgery, now the next question is, again, you look at the track records. Do you need additional treatment, no? Like chemotherapy, radiation? You look at the histopath result, no? And check whether there are information that will tell us that will indicate that you may need chemotherapy, no? If there are information that will tell you, medyo benign ito, medyo good prognosis, no? And then as a doctor, we also look at the track. Well, I call it track records. No, what are the evidences, no, that are available in the internet, no, that will tell us kung ito yung stage nito, ito yung sitwasyon, ano yung prognosis. Kung after the surgery, kung may positive lymph nodes, kung mataas ang incidence ng recurrence, no, then we have to give you additional treatment just to make sure, parang more of sigurista, but again, no assurance, na parang sigurista that there will be no recurrence, na yung lymph nodes kasi ganun din, na kung lymph nodes isa lang versus 4, let's say there are patients may 4 na lymph nodes, yung isa 0, isa 1, no? Iba-iba rin yung yung category of prognosis. Yung 0 mas pinakamaganda. Yung 1 mas not as good as 0 but better than 4. 4 or 5 or 6, di ba? Okay. Kung 4 or 5 or 6, all the more you have to be aggressive in your treatment. No? When you say treatment, specifically, we're talking about chemotherapy today. No? So you have to go for a chemotherapy. No? Okay? Okay. Yun
Okay.
sa'yo, good prognosis sa'yo, kaya huwag ka matakot. No? That's why we skip chemotherapy.
In
Okay?
fact, I am so glad that you had this session. I made sure that I am around to ask you questions.
Sure.
Kasi first, I have a friend, a nurse from the US, who told me na uh, if uh, if they remove one breast for breast cancer, they usually remove also the other para hindi na raw mag-transfer. Sabi ko, bakit ganun? Ganun. I think it depends upon the, again, uh, evaluation of the doctor. And again, I have a heart problem that might be also another factor, no? And again, it's really good that I learned about this, the pros and cons, if yes or no of chemotherapy. So thank you so much.
You're welcome. I usually I think I will go on with this pep talk even after the 3rd year has been completed on May 15 because I see the usefulness of this pep talk. Okay. One of the usefulness is that I can reinforce my explanation during the time of your consultation. Okay. Because
Yes.
usually I cannot I may give you a very detailed explanation, but I don't think you will be able to absorb all. No?
Yeah.
But I tried my best, and then I will reinforce it with such a pep talk. And then I also reinforce it with my blogs or my posts on my Facebook. No? That's part of my
They're very
program.
useful talaga. Worth reading.
Okay. And then as
Thank
to
you.
the yung mga sinasabi mong differences in the treatment, no, iba-iba, okay? So try to remember in the end it will be the patient who will have to make the decision, okay? Yung mga doctors have different viewpoints, different mindsets also. You still remember my talk on the 3 types of physicians and also the 3
Yes.
types of patients: ritualistic, minimalist, and maximalist.
Maximally.
Okay? Yung iba, yung pasyente, ganun din. May ritualistic, maximalist, and minimalist, maximalist. No? Kaya pinakamaganda dyan, minimalist, no? Okay, for both doctors and the patient. No? But nowadays, you see a different combinations going around in the Philippines as well as abroad. No? Kahit na abroad, iba-iba. No? So yung sinasabi ng yung friends mo, baka yung tinatawag na bilateral mastectomy, okay? Hindi naman lahat ay sang-ayon doon, na? Okay.
Yeah.
So if you look at in fact, if I can remember, one of the famous societies, cancer societies in America, I won't mention the name, they're not promoting prophylactic mastectomy, no? On the other side. No? Okay. Okay. So,
But it's
but for
prophylactic.
some patients, if they choose, okay lang, but that's their decision, di ba? Kasi very bihira rin ng mag-recur on the other side, na ang pinaka-main concern is the spread to the other to these two. Yung recurrence is from the original side, na bihira yung pumupunta sa kabila, na? Okay.
Okay.
So even if you do a prophylactic mastectomy, no guarantee that you won't have a recurrence, a breast cancer on yung second operations. Okay. Okay. So those are the Okay. So patient empowerment, na try to get as much as possible reliable informations. I hope I can give it to you, but as I said, I have a disclaimer. Now these are my thoughts, perceptions, opinions, recommendations. No, I don't expect everybody to agree with me. but I have just to continue on with my advocacy. Baka makakatulong somehow. No? Okay?
Yes, thank you.
You're welcome. Any other comments? Any comment? Sharing of experiences? Don't be afraid. Ang pinakamaganda rito sa session nito is sharing of experiences.
Doc.
Si Aji.
Yes po, Doc. Good afternoon po. Ayun, Doc. Thank you po, Doc, sa pep talk na ito. Marami po kaming napulot ng mother ko. My mother is beside me as well as my father para marinawan kami tungkol sa aming progress ng kanyang medication. Based dito sa topic niyo, Doc, ang pinaka main ko, Doc, is you cannot there's no such thing as written rule na pwede mo siyang pilitin yung isang pasyente kapag ayaw niyang magpakimo. Kasi sa part ng mother ko, Doc, share ko na rin po sa lahat ng mga participant. My mother was operated last 2016 sa left side, and then sa right side nagkaroon siya ng latest operation last December 2023. Nabasa ko, Doc, dito sa ating topic today is yung early detection. Na-detect naman siya agad and then pinatanggal na naman siya namin kaagad. Though my mother, as per her age and her physical and mental preparation o parang hindi siya ganun kahanda para mag-undergo ng chemotherapy. So she opted na other ways of treatment. And before nag-aano siya ng tamoxifen, and now nag-aano na siya ng letrozole for how many days? 40 days already. And then isang tanong ko, Doc, is kung yung kanyang medication is dire-diretso lang, Doc.
Okay. Okay, for the information of everybody, in fact, Aji also, I'm trying to get back to you now so that we can make some decisions, no, what to do.
Yes, po.
Baka kanina I was trying to look at my schedule. Baka pwede ka sa next Tuesday during the checkup so that we can discuss things, no? Okay. But at the moment, since you asked this question already, for the information of everybody, 2016 was the first operation of your mom. No, that was
Yes, po.
8 years ago. No, I think we did early stage, wala yatang nodes. No nodes.
Yes, po.
And then ER/PR was positive. HER2 was negative. Tama ba?
Negative po. No, nang ano po yung first niya po nung kanyang 2016.
Yeah, ER/PR positive. Tama? Tama, kaya ako nagbigay ng tamoxifen.
Yes po.
Okay?
Okay po.
Okay? And then, last year, we discovered another breast cancer on the
Yes po.
on the other
Right,
side.
right.
Na? Okay? I don't know
Yes,
which
po.
side na, which is which. Na? Pero early stage pa rin siya. Negative pa rin ang nodes niya. Na?
Yes po.
Pero ang lumabas sa ER/PR, naging triple negative.
Yes.
Tama?
Yun nga po
Triple
ang
negative.
aming
Okay.
yung naging ano namin, Doc.
So kung minsan, yan ang dilemma ng mga doktor. May mga doctor who will just accept yung report as is, no? May mga ibang doctor naman who will try to analyze things in a more holistic way, more comprehensive, no? Okay. Okay. So I'm trying to decide kung maniniwala ako doon sa triple, kasi kung babasihan natin sa triple negative, no? Okay. Baka kailangan more aggressive ang lalabas noon. So we have to give chemotherapy, ganon, di ba? Yan ang recommendations, no? Okay. But I'm still trying to decide whether, number one, to repeat. The option is to repeat it, no? Yung test, no? Or just to put it on hold, then just kasi yung based on the lymph nodes negative naman eh, di ba? Okay. So we just have probably another option is just continue on with the letrozole and then just check up. Na?
Yes
Okay.
po.
So I cannot make a final decision yet. I would rather have examine her again
Yes po.
before we make the decision. Na?
Yes
Okay.
po.
So kung pwede
Thank
kayo
you po, Doc.
next Tuesday, my next clinic, na tingnan na lang ninyo yung schedule ninyo. Kung
Yes
hindi,
po.
sa March
Mag-leave po
12.
ako ng message, Doc.
Sige. Okay?
Yes po, Doc. Thank you po.
Okay. So thank you for sharing that that information as well as may konting consultation. Okay lang 'yon, na? Okay. So pero para ma-illustrate natin to the audience, no?
Yes po.
Yung mga situations, no?
Napakalaga po ng topic ngayon, Doc, para sa amin.
Usually, triple negative. No. When we say triple negative, as a rule, as a protocol, which might not be 100% correct also, no, we give chemotherapy, di ba? Okay. But
Yes po.
may mga instances na sabihin natin negative ang lymph nodes niya, no? Tapos meron na siyang history na breast cancer before. 8 years is long, parang slow growing siya, may history na siya. Baka we might not consider giving her chemotherapy, just go for the hormonal therapy, no?
Yes po.
So yung mga decision making that we have to I have to make recommendations, no? I cannot decide for you.
Yes po.
Also I can do is to tell you the information and then my analysis and then my recommendations. In the end, as you said kanina, patient's decision, di ba? Okay.
Yes
So
po.
you ang magde-decide, na?
Yes
Okay?
po. Thank you po, Doc.
Okay, March 5.
Opo.
March 5.
Sige po. Thank you po, Doc.
Okay. So mute yourself na, Sally. Mute na. Okay. Any more questions? Who like to share on the issue on chemotherapy?
Ano ba tayo, Agi? Sa 5?
Ados pa lang
Aji,
next Tuesday.
mute, Aji.
Okay, mute na po.
Yung sa'yo.
Ay, sa akin po. Sorry, Doc.
Okay. Anybody else want to share? Cherry, if I may. Cherry Codillo. Pwede?
Jerry.
Aji, mute ka. Mute.
Doc, sorry. Nasa cellphone kasi ako, di ko kabisado yung ano ng Zoom. Naliligaw ako na wala yung mic.
Okay. So you cannot talk?
Ano po yun, Doc?
Would you like to share? Would you like to share?
Pwede naman po, Doc.
Okay. Pero Aji, sandali. Aji, mute ka lang, Aji.
Oo. Safe lang po, Doc. Yung sa akin kasi, kay Doc,
Aji,
yung
sandali.
just trusted po.
Sandali lang. Aji, paki-mute lang yung ano mo.
Ano ba, bibig?
Hindi ko makita, Doc. Teka lang.
Sige, good. Sige, Cherry, now.
Opo. Bali yung sa akin kasi back in 2022, December ako yung operation ko sa left breast. So I just trusted Doc Joson nung sinabi niyang wag na ako magpa-chemo. Although yung sa result nung histopath ko, as Doc Joson said niya na for other doctors, if I am a candidate for chemo. Pero since siya yung doctor ko, so nakita naman niya walang affected na nodes. Kaya sinabi niya sa akin na no need for chemo. And then after that, parang feeling ko may kailangan akong gawin. So nag-consult ako with another doctor naturopathy, parang mga ganyan. So maraming mga pinapagawang procedures sa akin doon. Merong immunotherapy, tapos may mga parang mga medicines din ako na tinitake eh. Yun. Then, kinonsult ko rin to kay Doc Roson. Sinabi ko rin kay Doc Roson yung pinuntahan ko na doctor, tapos kung anong mga procedures. And then, he told me na hindi naman, parang for him, hindi na kailangan. And meron siyang marami na rin siyang patients who have the same case as mine. And then, hindi naman nag-chemo. Okay naman sila until now. So ako, I just trusted him. Ganun na lang. Kaya until now wala akong chemotherapy. Pero alam mo yun, from time to time, kasi nga medyo anxious ako, yan ang sakit ko. Medyo ako parati, parang nag-iisip. So from time to time, naiisip ko, wala ba talaga akong dapat gawin? Nag-take lang ba ako ng tamoxifen? Ganon. Pero kaya nga sabi ko, parang ang tagal ng 2 months, Doc, na interval ng check-up natin. Kasi pag 2 months na, na yan eh, yung anxiety ko, medyo tumataas. Kaya sabi ko, kailangan magpa-check up na ako kasi meron na naman ako mga naiisip. So parang yung words lang ni Doc is parang assurance lang for me yun. Pag siya'y nakausap ko, so ma-assured na naman ako na okay, sige, ganito. Ayun.
Okay. Yung kay Cherry, okay. If I recall correctly, lymph nodes negative, tapos yung pinaka-size ng tumor on these mga less than 5, di ba? Less than 5, mga
Apo, nasa 2
point
nasa
something
1
lang.
point. Parang wala pa, Doc, na 2. Wala pang 2
Yeah.
cm.
Okay, so stage 1. Stage 1 siya, no? Stage 1, early stage, no? So, ang pinaka-importante doon, the lymph nodes, negative, no? Pero kasi gumawa tayo ng ERA, PRA, no? And HER2 new, di ba? HER2, no? Ang HER2
Yes.
was positive, no?
Yes, Doc.
Yung HER2 mo was positive also. Tama?
Apo, apo, yung HER2 is positive. Then yung, ano ba yung dalawa? PR ba yun?
ER-PR, positive yata, no?
Positive din pa ako.
Kaya binigyan kita ng tamoxifen. Now we settled for that, di ba? Okay. So,
Apo.
ako naman as a doctor, I look at what's going on in the field of breast cancer information, no? Yung mga So, may mga studies that shows na dapat bigyan, iba naman sabi dapat pwedeng hindi, no? Ganon. So, I just have to present the pros and cons to Cherry, di ba? Okay. So, but personally, I still think, of course, I cannot guarantee anything, no? Ang iniisip ko lang, I put importance on lymph nodes. Mas importante sa akin lymph nodes, no? Kaysa yung mga ER-PR. But I'm not saying that I don't put importance kahit na paano meron, no? Pero kung lymph nodes mo negatives, I've seen a lot of patients lymph nodes negative, HER2 positive, maganda rin ang prognosis, no? Although not 100%, no? Okay. So yun. So we discussed this with I discussed this with Cherry, and then she made the decision to just not go for the chemotherapy anymore, just the minimum is go for the hormonal. Kaya nagtatamoxifen siya ngayon, no? And then, of course, this another strategy, safeguard will be to closely monitor, no? Yung monitoring, kung may nag-recur, ganun, then we can still catch up, no? Try to catch up, no? Kaya importante yung monitoring, no? Okay. So, bakit every 2 months, natatakot ka na? Okay. So, anyway, lahat kayo kung may breast cancer, lahat kung may breast cancer or even some other cancers for that matter, we know that there's no guarantee for cure, no? It could recur, no, anytime, like kumisan kahit na 10 years, 20 years after. No, the approach is just to pray and hope na lang that it will not recur, no? I'm not trying to be religious, just trust in God na lang. Kasi everything that we do in this world, no? Kahit na outside the medical field, palaging, we don't know. Okay? Kanina sabi ko nga, only time will tell kung tama ang decision natin. Sabi ko kay Susan kanina, no? Okay. We just have to pray and hope, no? Okay? Just importante lang, monitoring lang, no? Okay. Thank you for sharing, Cherry.
Thank you po, Doc.
Any other persons who want to share? Helen, you want to share? Helen Makalad, Chu? Nasa Romblon ka na, Helen? Unmute.
No,
Ayan.
po, Doc.
Ha?
Next week pa po.
Okay. So you want to share?
Mayayain po ako, Doc eh.
Mahihain ka. O, sige. So, na-enlighten ka on what I discussed today?
Opo.
Okay. Sige. Just at least may natututo ka sa akin. Oh, Chris is raising her hand.
Hello, Doc. Hello,
Hello,
everyone.
Chris.
Good afternoon. Actually, sorry na late ako ng pag-join. Sorry, Doc. Just want to share, no, yung sa case ko kasi, breast CA ako, stage 2, nung na-detect. So, medyo malaki na. So, kaya nag-undergo po talaga ako ng chemotherapy. ER/PR HER2 positive ako, just to share lang po. So, nag-undergo ako ng chemotherapy, tapos meron pa akong targeted chemo na parang ano yata yun, parang
Trastuzumab.
18, yung trastuzumab po na parang 18 dose. So, tinawid ko siya. Tapos nung nag-ano ko, Doc, nung nag-operation ako, nag-undergo ako ng operation, parang wala na silang nakita. Pero yung surgeon ko nag-recommend na mag-radiation ako, pero yung onco ko nag-recommend na hindi na ako mag-radiation, yung onco ko nag-recommend na mag-radiation. So nag-undergo pa rin ako ng radiation. Ngayon po, naka-hormonal dose ako. Ang problem ko po, Doc, pag nag-hormonal dose pala, sobra daw pong mag-gain ng weight.
Hormonal. Okay.
Opo, nag-triptorelin, pamorilin po ako.
Ano?
Nagpa-pamorilin dose. Nagpa-pamorilin ako kasi yung nag-force, kasi di pa ako menopause So nag-force menopausal, tapos ang gamot ko po ay anastrozole everyday. Yun yung daily ko. Kasi nagtamoxifen ako, parang nag-bleeding ako that time nung first month ako ng tamoxifen.
Okay.
So in-stop yun, nag-ovary suppression ako, tapos nag-anastrozole ako ng 1 mg a day.
Okay.
Ang hirap po ngayon na dinideal ko is ang laki, nagigain ng weight kahit halos hindi naman sa hindi ako kumakain or sadyang matakaw lang po talaga ako, pero mahirap talaga siya, Doc, mag-lose po ng weight. Ganun talaga yon.
I don't know exactly kasi baka may other factors, no? Not only the drugs, but also yung metabolism mo, and then of course the amount of foods that you're eating, no? Pwede rin, or lack of exercise. Maraming factors, no? Okay. So, but try to
Ayun.
control your weight through other means, no? Outside the drugs, no? Baka pwede pa, no? Okay.
Opo. Ngayon nagta-try ako ng ibang way po tulad po ng sinabi niyo. So yun. So gusto ko lang i-share sa mga kasama ko na really totoo talaga to. You trust your doctors na lang talaga kasi totoo yung sinasabi. Sobrang thankful. Gusto ko mag-thank you talaga nung na-meet ko si Doc Joson. Sobrang, actually, ang na-gain ko dito sa webinar na to, natuto ako kung paano mag-analyze ng mga laboratories, kung anong dapat gawin, yung ganun, sobra po kaming natuto doon, Doc. Thank you so much. Tapos, yun po, yung trust your doctor talaga. So, kung sinasabi nila na, kasi yung anxiety kasi attack, yun talaga yung umaano sa amin, di talaga siya minsan nakokontrol, ganun talaga siya eh. Pero, again, pray and hope lang na sana, hopefully, ginawa na natin yung lahat. So, sana, wag nang bumalik. Ganon.
Yeah.
Thank
Okay.
you. Ganun na lang kasi sa akin din personally, nangyayari din yun sa akin. Kaya gusto kong i-share na let's just pray talaga na na sana ginawa na natin yung lahat. So sana hindi na siya bumalik.
Okay. Okay. Thank you for sharing, Chris. No?
Thank
So
you
in
po.
the end, it will be pray and hope. Pero before the pray and hope, dapat merong konting kaalaman. No? And then try to make some decisions based on the other 4 case, diba? Other three case, no? And then on my part naman, I'm just trying my best to give you information as best as I can, no? I'm not claiming that everything that I say here are talagang absolutely correct, no? Minsan may mga opinions pa rin yan, no? Kaya may caveat ako, but I'll try my best, no? Okay. So, kung it's already at 3:15, if there are no more other people who wants to share, we'll call it a day. No? Okay. Wala na? Walang questions sa chat box, sabi?
Wala.
Okay. Oh,
There's none.
okay, there's none. Okay. So, wala na? Last call? Maria? Are you going to talk? Maria Hustapolotan, are you nagla-light up yung box mo?
Ay, sorry. Sorry po. Hindi po.
Okay. I thought you want to talk. Okay. So kung wala na, we'll call it a day. We'll see each other next week. No? Ano bang magiging topic natin next week? You can see that I'm trying to focus yung discussion ngayon on health issues, no? Compared to last year, may mga health awareness calendar and also yung mga health disorder. Ngayon, I'll try my best to talk on specific issues now. No? Okay. Okay. So probably I'm thinking of the next topic is do we all have cancer cells in the body? No? Okay. For next week. No? Okay. So invite your friends to attend. No? Medyo I think all the pag health issue maraming pinag-uusapan, maraming interesado. No? Okay. Okay. So with that, we call it a day. We'll see each other next week. No? Okay. Bye-bye.
Bye po. Thank you po.
Thank you, Doc. Bye-bye. Happy weekend.
Welcome.
Everyone.
Thank you po, Doc.
Thank you.
Bye-bye.
Bye-bye.
Thank you po.
Bye-bye.
Ano na?